According to the National Institute of Health, chronic pain affects more people than diabetes, heart disease, and cancer combined. It is also the most common cause of long-term disability. So why on earth do we know so little about it? And if so many people suffer from conditions that cause chronic pain, why is there such a stigma attached to it? Joining me to discuss in the Google Hangout, we have Gordon Selly, an author and speaker who has struggled with chronic pain for over 18 years, Jenna Collins, a student at De Anza College who suffers from mixed connective tissue disease, Mallory Smith, a student at Stanford University who suffers from cystic fibrosis, and Dr. Gregory Smith, the president of the Comprehensive Pain Relief Group, and Dr. Isaac Kashani, a cosmetic dentist. Thank you so much for joining me, everyone.
Thank you.
Hello.
Gordon, I got to start with you. You've been dealing with chronic pain for over 18 years, and you feel that there's a stigma attached. Can you tell me a little bit about your story and why you feel this way?
Well, my story is unique because I've also been a doctor, a chiropractic physician, as well as being a patient. And the stigma a lot of times with chronic pain is that a lot of people who have chronic pain look normal to a lot of the population. And we know that approximately 80 to 120 million people suffer from some form of chronic pain, whether that's emotional, physical, spiritual crisis, whatever the etiology is. And there is a great stigma attached to it because people don't understand it. They're afraid of it. They stay away from it. So that's what I've observed over 18 years.
And how did you fall sick? How did you realize that you were dealing with chronic pain?
Well, I had 4 neck surgeries, and I have 1 disc in my neck left. I developed reflex sympathetic dystrophy, which is also the complex regional pain syndrome. And I just had a sequela of different disorders that just came right off of that. So I've dealt with, for instance, 4 years, I hardly had a sleepless night. I dealt with heavy medication use, the same type of findings that a lot of people deal with chronic pain. And I still deal with chronic pain every day. And yet I'm living a transformed life because I reached a point where I thought, I can't keep medicating it. I can't ignore it. I can't deny it. Even with my faith, I wasn't able to pray it away. So I went to a point of saying, I have to embrace this trial that I'm in. I have to embrace the brokenness that I'm experiencing and learn how to forgive pain and move in different ways so that I could exercise regularly, make different life choices, live a more transformed life. So those are the things that I've done. And I put that in a book entitled Living Beyond the Pain, where I know a lot of readers are going to identify with that.
We have a comment here from VC Eden and talking about how chronic pain is a vague and hard issue to prove. Mallory, you're a student at Stanford. You have cystic fibrosis. To the unknowing eye, there doesn't seem to be anything wrong with you, which can cause stigma and problem when you're looking for help or just trying to explain your issues.
Yeah, I've definitely noticed, especially as a student, throughout high school and in college, that a lot of times I'm dealing with academic accommodations or just making new friends, that people look at you and immediately think one thing about what your life is like. So people look at me and obviously do not expect that I suffer from such a serious medical condition and that it does affect me almost every minute of every day. So I found that that's kind of hard to portray it to people without sounding like you're being a hypochondriac or sound like you're complaining all the time. So striking that balance between not complaining all the time, but also letting people know and understand what's really going on that they might not see has sort of been a difficult thing for me to figure out how to do.
Jenna, I'm sure you can relate. You are also a student, and you have 3 different chronic illnesses.
Yes, I can definitely relate to what Mallory is saying. I've had to be out of school for long periods of time because of different issues, or I've had to drop out of school at times because I was in the hospital for 2 months and obviously couldn't keep up. And it is hard because on the other side of that, growing up, I have mixed connective tissue disease, which includes rheumatoid arthritis, which a lot of people know about, but also scleroderma, which is a fatal illness as well as a chronic illness, dermatomyositis, which is another muscle disease, very painful, Sjogren's, which is a syndrome, kind of hard to to talk about all of them. And then also I've had complications that have involved neurological problems. So I've had tons of things going on. And, you know, when I was doing well, I'd be doing extremely well. And I was a competitive dancer. And then I would just get unbelievably sick and be in the hospital and hardly be able to move or not be able to get out of bed one morning because I could barely lift my head. It was this real shift. And I definitely relate to that people see you in one way and they can't even imagine the other side. And it is hard to express that. A lot of times, actually, I would never want to. As a child and growing up, I would very often try not to tell people, and it's only as an adult that I've gotten more comfortable with talking about it.
And Dr. Smith, exactly what she's saying is a large problem. So many people deal with this, and they're so afraid of the stigma and the shame and just not being considered normal, but it's pretty normal. So many people are dealing with chronic pain.
Well, you know, we've heard from different people here on the panel, and the one thing that's in common here is when you hear about chronic pain, what's really not often talked about is what's called chronic pain syndrome, is what these people are really suffering from. And chronic pain syndrome encompasses chronic pain, but also identifies other things like chronic insomnia, anxiety, depression, all kinds of other things that happen. Anybody that's been in pain for months, years, even decades, develop all these collateral problems that often become just as serious, if not more serious, than the pain itself. And because of that, because it's very complex, very few physicians out there understand how to treat these problems. So people, on top of having a bad situation, are being treated poorly. Chronic pain is treated exceedingly poor, not only in this country, but worldwide. And that's why chronic pain is an epidemic, not only in the United States, but all over the world at this point in time. So a huge problem, and people need to take a different approach than just giving pills and epidurals and procedures and surgeries for pain, because I've always said you can't treat chronic pain syndrome with a pill. You can't treat chronic pain syndrome with surgery.
Well, what can you treat chronic pain syndrome with then?
That's the great question. Chronic pain syndrome, the way that I look at it, I came up with something called NESP or NESP, the NESP program, about 7, 8 years ago. And it's an acronym that stands for nutritional, emotional, social, financial, physical, and psychological, what I call the 6 aspects of the chronic pain experience, because it's an experience. It's not just pain. Most people think about pain like getting stabbed with a knife or touching a hot stove. Chronic pain changes the nervous system. The nervous system is plastic. So when you have a situation where people are constantly being bombarded by pain signals day after day, month after month, year after year, the nervous system changes, becomes plastic, and people actually become more susceptible to pain the longer they're in pain. This is why you can touch a pain patient lightly in some spots, and they go through the roof in pain, whereas if you touch someone else that doesn't have pain in that same spot, it wouldn't hurt at all. So it's a very complex situation. So having said that, you have these aspects, you have to treat all these aspects. So this is nutritional, this is psychological, things like medical hypnotherapy. It goes far beyond just throwing narcotics at the problem.
And Dr. Kashani, you can weigh in here too, because there's all kinds of different types of pain. There's joint pain, there's nerve pain, and you deal a lot with dental pain, which people often don't realize is such a big deal with people who are dealing with chronic pain.
Of course, we, as well as dental pain, we also connected to all these issues we're having. We can talk about TMJ disorder, which about 12% of our population, 35 million people are suffering from, majority being women from the ages of 15 to 35. And we have a few remedies for it. My approach is generally to try to be as homeopathic as possible. And I start off patients with definitely recommending before they sleep to trying to do some exercise such as yoga or some kind of a workout or something to de-stress them before they go to sleep, so maybe they can, try to sleep a little bit better. For all those out there that don't know what TMJ or TMJ disorder or TMD for that matter is, it's a disorder where you're grinding your teeth at night, and it's causing muscle. It's caused from muscle spasms, your masseter muscle spasming, and your teeth grinding uncontrollably while you're sleeping.
So we're seeing there's so many different ways, and I know that Jenna, Mallory, Gordon, you can talk about all of the different things that you experience. And one of the things that we find is there's so many different avenues for chronic pain. A recent study shows that we have here that 12% of Kiwis from New Zealand suffer from chronic pain, but the problem is 65% of them doubt the reality of their pain. Have any of you ever had a time in your life, right now, you're here talking to us as an advocate, but you who are suffering, have you ever doubted that what you were going through was actually real?
I absolutely have. I know that there's been multiple times in my life where I just have severe stomach pain for months at a time or weeks at a time, and sometimes I just feel like, oh, everybody has this. Everybody gets stomach aches. It's totally fine. And then when it gets to a certain point, I'll go to the emergency room and find that something is actually terribly wrong. So it's definitely interesting how the culture of being around other people who don't know that there's anything wrong with you can sometimes make you feel like you're imagining things. Imagining pain.
I wanted to jump in and just say that it's really difficult when you have people that are young, especially if they're young and attractive, that have chronic pain, because a lot of times the medical establishment doesn't believe them. They'll tell them things like, you're too young to have pain. Or, and it's ridiculous, because if someone came in with a broken leg after skiing and they had a big cast, everyone would open the door for you. They would help you. But you have a young woman, attractive young woman come in that's 25, 30 years old, and nobody believes that they're in pain, and some people are suffering 24/7 beyond belief. Things that the average person takes for granted, like getting out of bed, like driving, like going to the grocery store, like combing their hair.
Or even just going to the airport like a normal person. Let's talk we talk about the attractive young ladies, but let's talk about the attractive man here, Gordon, who, you deal with this, you've dealt with this. Tell us what you experience, because people don't necessarily believe that you have chronic pain issues.
Well, one thing that's involved is that I'm dealing with also a family unit. And so I have two children, one age 24, the other one's 21 years old. You cannot let chronic pain spread throughout the family directly every day, or you will not have a family. In fact, about 85% of people who have chronic pain for more than a year end up getting divorced. So to keep a marriage together, you have to be absolutely in tune with relationships. But on the practical level, even today, my beautiful wife, I'll get the groceries, but I cannot lift anything over 5 pounds. If I lift something over 5 pounds, I may not urinate for a day. I may be up at 1:30 in the morning for 3 or 4 days in a row. So I know what I should not do. As much as I have appreciated all the crisis management, pain management that I've had and been given by my doctors, there's a point when you say at 18 years, timeout, I can't do this for 30 years, 40 years, 50 years. Maybe pain is not totally a medical problem or a medical solution. That's where I looked spiritually. That's what helped move me in a completely different direction. And I know people used to look at me and say, I used to weigh 225 pounds. I weigh 160 pounds now. He's fat. He's lazy. He's a procrastinator. He has an excuse. We don't want to catch what he has. Even though he used to be very successful and financially well off, look at him now. We don't want to be around that. We don't want to catch chronic pain. And then the people who do care for you, they do not know how to identify with you and connect. I've noticed that even in the church, as much as they'll say, I'll pray for you, and then they're gone. Chronic pain is still very mysterious. It's very secret. There's some issues that still have to be addressed with it. So definitely.
Jenna, I want to go to you because you've been coping with this for such a long time. How do you deal? How do you handle your chronic pain?
Well, I think it depends on the day, but I would say it has a lot to do with attitude. I think that I don't let it get me down ever since I was a kid. I just decided I still had to do everything that I really wanted to do that would make my life enjoyable. And that would often mean I was in even more pain. And it could mean that sometimes I was even sicker. But often in the long run, I think it improved my health because it improved my spirit and my quality of life. And I think that's a big issue in dealing with it is you have to have quality of life in order to fight an illness or chronic pain. Otherwise, you just feel like, what's the point? And so that's, I think, how I've dealt with it. I've made sure I have a really high quality of life. I've made sure that I don't let it stop me from going after everything that I want, like continuing in school. Like I said, I had to take a 5-year absence and basically start again at ground zero in college. But I just decided, I was going to go for it and do it and do whatever I had to. So I would say it's mainly attitude.
I love your attitude. Honestly, you know what's really interesting about this whole thing? Everyone on this panel is dealing with pain, and of course our 2 doctors. You guys are doing more than most people who aren't dealing with chronic pain. Mallory, I saw you over there shaking your head when she was talking. What are some of the things that you do to cope? I know that I'm sure a lot of the things are similar, but what are some strategies that you've developed to deal with your chronic pain?
Well, one thing I want to just say first off, before talking about how I cope with it, I think it's really important to mention that people with chronic pain do not have to be martyrs. Like, I don't think that you have to suffer if there is a solution for you. So I know that in my case, like, I used to be very against taking pain medication. And then now I realize, like, if I'm in pain and it's reducing my quality of life and I take medication and I feel better and it makes me happier, then there's nothing wrong with that. So I think, I definitely, I know Dr. Smith can speak about the American public being way too addicted to medications, but just to pitch the opposite side, I wouldn't be alive without these medications. So I think I just wanted to emphasize that you don't have to suffer through pain and only try to fix it mentally if there is medication there available to help you. But in terms of just my own coping, I would say, like Jenna was saying, athletics have been a really important part of my life. They do slow the progression of cystic fibrosis. So it is medically very helpful to participate in sports, but also just being active is a really good way of feeling like you still have power over your own life and sort of exercising that power in something very specific and compact. So that's probably my number one mechanism.
I agree, though, that pills are not necessarily bad. I don't want to come across to say pills are bad, because pills, if you have severe pain, that's what the medication is for. I think the problem is that, unfortunately, in this country, often because of the way medicine has gone, where there's less time with the patient, et cetera, and people are being rushed in and out, there's an emphasis on just medication only. And then you do have, you guys on this whole panel are to me, exceptions. A lot of people let chronic pain overtake them where they don't even leave the house. They're in bed all day just taking pills. And that's where it becomes really a big problem.
So then, okay, so in trying to find a solution, even though it's not one size fits all, pain for different people comes from different places, whether it's neurological or joint or muscle or wherever. What are some things that people can do to try to help their situations?
I feel like exercise is definitely one of the strengthening things that anyone can do if possible, physically are able to. I think it with any kind of pain, your body being stronger. Nutrition, as his acronym he came up with, is one of the six facets of his acronym, right, Doctor?
Yes, 6 aspects of chronic pain. Yeah.
Right. So that's my 2 cents.
Yeah, I would say inner transformation for me has been the core to it all, is having a stronger relationship with God. And then from there, I've seen the physical changes, the manifestation occur. And I do exercise regularly. I walk a 5K every day. And since 2006, I will not miss no matter what. Also,